Okay.
Okay, so today we're gonna go over burns. Um,
So before we start, I had a question.
Sorry, what?
So, um, so after we're done with the book, we're gonna do our write-outs and our how's
The
that gonna work?
rotations. Yeah.
Yeah, okay.
Let
And
me
do
see
we
what.
just try to find an EMT service, or you want us to do it with a specific one?
Actually, I need to talk to the local companies around here.
Okay.
Uh, because ideally you still have to pass the class before you actually do the rotations.
Okay.
Uh, so right now and next week I'm gonna if you look at your schedule, we don't have anything scheduled. I'm just gonna go and give you some assignments because I'm gonna be out on a conference. So
Okay.
see if I can do this. So again, today we're going to cover chapter 29. That's it. I did cover a little bit. I've given you guys the links to what do you call it? The videos in case you missed.
Yeah, I
So
missed on Friday, so I'm gonna watch the video as soon as we're done with this class.
okay. So again, burns, and it's almost the same thing that we went to when we're dealing with the burns back when we're taking the ECA class.
Okay.
Uh, but in this case, we're gonna just get a little bit more detailed. So burns affect multiple body systems in addition to just affecting the skin. Body temperatures regulation is a significant concern in burn patients because once they lose that barrier, uh, heat dissipates very fast. And EMTs must have an understanding of types of burns and how they actually affect patients. Okay, so now to start off with a little bit of the anatomy, the layers of the skin, you have the three different layers of the skin, which is what you see the outermost part of the skin, also known as the epidermis. So that's the epidermis, the outermost layer, the dermis itself, which is sandwiched in between the subcutaneous layer and the dermis. And of course, we have the subcutaneous layer. Uh, Now, it also depends on uh, how deep the burn goes. So we need to classify burns and how deep they are. The skin is the largest organ in the body also, and it does a lot, has a lot of functions. It forms a physical barrier from the external environment. It insulates and protects the body itself. Hold on, give me a few seconds. I don't know what's going on. Sorry, it's, I have a washing machine right next to me going off crazy. So anyway, it also insulates and protects the body. It's a barrier. It's what it is. Give me a few seconds. Okay. So it functions. It also insulates the body and protects the body. It provides sensory perception, or that's where all of our nerves are actually attached to. Well, not all of our nerves, the sensory nerves. It's both the temperature and sensory and pressure nerves. It also eliminates some body waste products by sweating and whatsoever, and also aids in the production of vitamin D. And the way it does this is basically uh, by you taking vitamin D and then you get exposed to the sun, your melanocytes themselves, which is the 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 cells that produce pigment in our system, actually activate it and biotransform the vitamin D into a different type of vitamin D that our body can use. And because you can take all the vitamin D in the world right now, but if you don't go out to the sun, it's not gonna do. It's not gonna do anything. So you need to get it activated into a different form of vitamin D. Okay, most burn patients die in the pre-hospital setting from an occluded airway caused by superheated gases or whatsoever, toxic inhalation, or other trauma. Main, uh, Maintain a patent airway and then adequate ventilation and oxygenation and control life-threatening bleeding. In the circulatory system, the burn injuries can actually cause extreme body loss, extreme fluid loss, I'm sorry. Burns also increase capillary permeability, which decreases the intravascular fluid, and edema can actually further compromise tissue perfusion. The fluid shift results in hypovolemia, and which losing, fluids, specifically in the form of the plasma itself. Burns and inhalation and superheated air can actually cause obstruction of the airway. Toxin-induced lung injury. Smoke can actually smoke and toxic gases can actually cause respiratory compromise and poisoning. You have cyanide, and all these chemicals that you see here are actually produced by burnt plastics. Like the cars are made of plastic mainly nowadays, so you get cyanide, carbon monoxide, sulfur, and hydrogen chloride. In the renal system, you have a decreased blood flow to the kidneys, which reduces the urine output. Okay, the kidneys must actually handle an increased amount of waste products from the cell destruction when it comes to burns. And if for whatever reason you get hypovolemic, and also you lose a lot of fluid, you're not able to get rid of these toxins. So the other thing that can happen is the kidney failure usually occurs also. Okay. In the nervous and musculoskeletal system, you have nerve endings can actually be destroyed, and have loss of function of or extremities can actually result. Now, whenever we're dealing with burns, specifically when we're trying to treat burns, there's some things that you actually have to do for the body itself to maintain a functional portion of the body, specifically when it happens to the hands and feet. So you have a decreased GI perfusions can actually cause nausea and vomiting. And long-term considerations include ulcers and ensuring an adequate nutritional supply. So basically, if you're not eating, you don't get nourished. So you get what we call a malnourished syndrome. Okay, classifying burns by death. And when I first learned about burns back in the day, we called it first degree, second degree, and third degree. Simple as that. Now there's it's still first degree, second degree, and third degree, but now we have a fourth degree, and they also have a different name, like superficial burns, which is just basically like a sunburn. It's called first degree burn. Partial thickness will be second degree burn, and full thickness will be third degree burn. And whenever we have a burn from electrical injuries, it usually results in fourth degree burns. Now, superficial burns involve only the epidermis itself. Now, it's the reddening, like a sunburn. Classification of burns, you have superficial first degree involves only the epidermis. Partial thickness, which is second degree burn. Superficial partial thickness burns. Deep partial thickness burns also. And full thickness, which is a third degree, you have eschar, which is basically burnt skin. It becomes leathery. Okay, tough, leathery, dead, soft tissue. And the electrical burns may actually result in fourth degree burns, and only because electricity travels through the fastest medium possible. And in our body, it's the fluid. So whenever we're talking about somebody getting electrocuted, we also have to worry about heart conditions, because guess where blood goes through? The heart. That's what pumps it around. And the issue with that is that you have not only an issue with that, but you have an issue with it causing a dysrhythmia or stopping the heart from the electrical shock. And I know that in a couple of occasions, I've talked about second degree burns. You have first degree burns, it's just reddening, okay, and it only involves the dermis. But when you have second degree, epidermis. But when you have second degree, it involves the dermis and the epidermis, and that's when you start getting blistering. Third degree, uh, in a lot of cases, they're painless because you burn all the way through where the nerve endings are at. So the nerve endings are not alive anymore. But usually, where there's a third degree burn or a full thickness burn, you're going to have a second degree surrounding it, and you're going to have the first degree so now surrounding that. So partial thickness burns, what you get to see is just reddening of the skin. I mean, superficial burns. Did I say partial thickness burns? Yeah. Okay. In partial thickness burns, you can also see that there is blistering occurring. Third degree, I mean, partial thickness burns, you get to see, how the skin is actually, the epidermis is actually burned off in these regions, and it exposes the underlying tissue beneath the skin itself to actually being bombarded with bacteria and whatsoever. Full thickness burns, you get to see that it's a deeper burn itself in certain areas. And I'll show you another one right here. If you get to see this one, man, this is really like burned through the whole muscle tissue and everything. So classification of burns. Burns are classified by the severity or treatment and transport decisions. The factors in determining burn severity, you have the depth of the burn, location of the burn, patient's age, pre-existing medical conditions, and percentages of the body surface area involved. So this is important because we have to use what we call the rule of nines or the rule of palms. And basically, it kind of dictates on what the surface area of the body got burned. And we do this to actually figure out how severe the burn is. So classification burns by severity. Burns injury location in the face. You have risk of inhalation injury. You might actually breathe in superheated air and it causes damage to the lining of the lungs, which basically is going to close off the lungs. You have hands and feet, loss of joint function, and you have circumferential burns. Now, circumferential burns are burns that actually go around, let's say in the arm itself, it goes all around the arm. And when skin gets burned, it gets tight. And when it gets tight, it kind of cinches off. It works like what do you call it? A tourniquet. So you might actually, there's a couple of procedures that we do out there where we actually get a scalpel and cut the skin so that the skin can actually stretch out. Age and pre-existing medical conditions. Children under the age of 2 and adults over the age of 50 have less tolerance for burn injury. Children have a potential for greater fluid loss. Fluid and heat loss are greater in infants and children than in adults. And consider the possibility of child abuse in some cases. Uh, Critical burns, you have full thickness burns involving hands, feet, face, eyes, ears, and genitalia. Now, it's a full thickness burn, it's a third degree burn. Okay. Burns associated with respiratory injury. In other words, you might have actually breathed in superheated air and whatsoever. Full thickness burns covering more than 10% of the body surface area. Now, 10%, if you really think about it, it's not that much. So any partial thickness, full thickness burn that's 10% is already considered a critical burn. Then we have partial thickness burns covering more than 25%. And the partial thickness burns, remember, is the second degree. It only goes up to the dermis, but if it covers more than 25%, this is a critical burn. Now you have partial thickness burns, 20% in children less than 10 years of age and adults more than 50 years of age. Chemical burns or high voltage electrical burns. Also, burns complicated by fractures or major trauma, and you have moderate burns in young children or elderly patients. Circumferential burns to any body part, such as the arms, legs, and chest. So anywhere, anytime, like if it's around the chest, that chest is gonna feel so tight that you're not gonna be able to breathe. And the procedure is called the episiotomy. I'm sorry, I got tongue tied right now. Okay. So again, another look. Minor burns. is less than 10% of body surface area in adult, or less than 5% body surface area in young or very old, and less than 2% body surface area full thickness burn. So when it's a full thickness burn that's less than 2% is considered minor. And a moderate version, a moderate burn, 10 to 20% of body surface area burns in an adult, 5 to 10% body surface area burns in young or the very old, 2 to 5% body surface area full thickness burns, high voltage injury, uh, suspected inhalation injury, circumferential burns, or comorbid factor increasing the risk of infection, like you have diabetes, sickle cell anemia, or immunosuppressed patients. And major burns, greater than 20% of body surface area burns in adults, greater than 10% of body surface area burns in young and very old, and greater than 5% full thickness burns. And the minor is less than 2%, and this is greater than 10%. High voltage burns also, known inhalation injury, burns to the face, eyes, ears, genitalia, or joints, and other significant injuries like fractures or major trauma. Here, what you get to see here is you get to see it's actually superheated air. And this is supposed to be the mustache, and the mustache actually got burned off. So that means that the person might have inhaled superheated air and actually gotten, what do you call it, lung tissue damage. So classification of burns by burn size. I was using the body surface area. Yeah, the rule of nines is a standardized way to actually quickly determine the body surface area percentage of the body. Do not include the superficial burns at this point. It's just a second degree and third degree. Percentage differs in children and adults, and we use the rule of ones, which this is a rule of nines and this is a rule of ones. And you have to imagine the size of the patient's hand and to cover that part. So that would be the rule of ones. Now, I'm going to go over something here. Give me a few seconds. I got a video that I got from YouTube to actually explain. Let me see which one. How long is this one? Let me see. Okay, let me see this one. Let's see so you can see it. Okay, so this is basically, not the Swiffer model itself.
Love it or your money back.
Okay.
Get a jumpstart on your career and future. Offered through the PHA Early College Program, the School of Business and Industry offers numerous academies for high school students.
Welcome to the channel where medical topics are made easy. Today we're going to go over the rule of nines, which is used in burn patients as a quick way to estimate the total body surface area involved. This also pops up on medical and nursing exams, so it's good to know this topic. We'll go through a simple table, and there will be examples at the end, so make sure to watch the entire video. As always, you can find the notes and study guide for the video linked below. All of the videos come with notes, so make sure to subscribe to not miss out on those. As we mentioned before, the rule of nines is used in burn patients to calculate the total body surface area affected by second degree and third degree burns. This helps guide the patient's care, estimate fluid resuscitation, and determine if the patient requires care at a specialized burn center. The rule of nines only applies to partial thickness and full thickness burns, which are second and third degree burns. It does not apply to superficial burns, which are first degree burns. Let's walk through the table and diagram, and you'll quickly see why it's called the rule of nines and how it works. The rule of nines provides you with an estimated percentage of the body surface area for different body parts. So what do we mean by that? Well, let's take a look at the table. The entire head and neck make up 9% of the total body surface area. The entire right arm and left arm each make up 9% of the total body surface area. The entire trunk has a body surface area of 36%. The groin has a body surface area of 1%. And the entire right leg and left leg each make up 18% of the total body surface area, and this totals 100%. The easy way to remember this is to go in alphabetical order. First we have the A and H for arms and head, which are each 9%. Next we have the L for legs, which has a higher body surface area of 18%. Finally we have the T for trunk, which has an even higher body surface area of 36%. Once you have committed that to memory, the rest becomes easy. With the exception of the groin, you can see how the percentages are multiples of 9, which is why the rule gets its name. The rule of nines is used in adult patients who are not obese. When it comes to pediatric and obese patients, the accuracy of the rule of nines can be affected, which we'll cover at the end. Now you can see the table shows the percentages of entire body parts, so let's apply it to the front and back of the body. All we're going to do is divide each percentage in half. We know the entire head and neck is 9%, so the face and anterior neck make up 4.5%, and the posterior head and neck make up 4.5%. The entire right arm is 9%, so the anterior right arm has a body surface area of 4.5%, and the posterior right arm has a body surface area of 4.5%. The left arm is the same, where the anterior and posterior sides each make up 4.5%. The entire trunk is 36%, so the anterior trunk is 18%, and the posterior trunk is 18%. You can break down the anterior trunk even more, where the chest is 9% and the abdomen is 9%. The groin is 1%. The entire right leg has a body surface area of 18%, so the anterior side is 9% and the posterior side is 9%. The left leg is the same, where the anterior and posterior sides each make up 9%. Again, you can see how the percentages for the anterior and posterior sides are multiples of 9, hence the name rule of nines. Let's look at a couple examples now. Try to figure out the total body surface area for each burn. The first patient has partial thickness burns involving the entire anterior chest and the entire anterior right arm. Hit pause on the video and figure out the total body surface area involved. We know the anterior trunk is 18%. Remember, the entire trunk is 36%, so just the anterior side is 18%. This burn only involves half of the anterior trunk because it only involves the chest and not the abdomen. So the burn to the anterior chest has a body surface area of 9%. Next we have the burn involving the entire anterior right arm. We know the entire right arm has a body surface area of 9%. Since this burn only involves the anterior aspect, then it's 4.5%. So this patient with partial thickness burns to the anterior chest and anterior right arm involves a total body surface area of 13.5%. Let's look at one more example. This patient has a full thickness burn to the distal anterior left arm and a partial thickness burn to the proximal anterior left leg. Hit pause in the video and try to figure out the total body surface area involved. We know the entire left arm is 9% and the anterior side is 4.5%. Well, this burn only involves half of the anterior aspect, which would give it a body surface area of approximately 2%. Next, we have the burn to the proximal anterior left leg. We know the entire left leg is 18%, with the anterior aspect totaling 9%. Since this burn involves half of the anterior aspect, the body surface area would be approximately 4.5%. So this patient's burns involve a total body surface area of about 6.5%.
There you go.
There are a few things you should know about the rule of nines. Remember, the rule of nines only applies to partial thickness and full thickness burns. Superficial burns are not included in the total body surface area assessment. The patient's palm, not including their digits, is approximately 0.5% body surface area, and their entire hand, including their digits, is roughly 0.8 to 1% body surface area. So for smaller burns that might only be 1 to 2% total body surface area, you can use the size of the patient's hand to approximate the area involved. Burn patients can have fluid losses from damage to the skin and losing that skin barrier, as well as capillary leak. So figuring out the total body surface area involved is important in estimating fluid resuscitation, along with the patient's overall care and potential need for treatment at a designated burn center. There are equations such as the Parkland formula that help you figure out how much fluid resuscitation the patient requires using their total body surface area involved. We'll go into that more in the next video. As we mentioned before, the rule of nines can be applied to non-obese adults. Patients that are defined as obese based on their BMI have disproportionately larger trunks, and the rule of nines is typically inaccurate. The body surface area of the trunk in obese patients can be closer to 50% compared to their non-obese counterparts with a trunk of 36%. Due to their disproportionate trunk size, the other body surface area percentages are slightly different in obese patients, as you can see in the table and diagram. The numbers you see on the diagram are the totals for both the front and back. These percentages are approximations, as they can vary among obese patients. We can see the entire head and neck is 6%, each arm is 7%, the groin is 1%, and each leg is 15%. The other patient population in which the rule of nines is inaccurate is pediatrics. Pediatric patients have disproportionately larger heads and shorter legs. This table and diagram will give you approximate percentages for infants and young children. These numbers will change in older pediatric patients. We can see the head is disproportionately larger at 21% instead of 9%. Each arm is about 10%, the entire trunk is about 26%, the buttocks and groin area are about 6%, and each leg is about 13.5%. Now it's your turn to fill in the table and diagram. Hit pause in the video and try to fill in the numbers for an adult on your own using the rule of nines. Once you think you have the answers, hit play again to reveal the correct numbers. The answers are going to be revealed in a couple seconds.
So this
Here
is
you can
just
see the correct
memorization, guys.
responses. Hopefully you're able to get them all correct. Hopefully this gave you an easy way to remember the rule of nines for burn assessments. If you found the
Okay, so we'll continue with. And it's something, I mean, it's something you're just going to have to memorize. So then we have the types of burns that usually occur. We have thermal burns, inhalation burns, chemical burns, electrical burns, and radiation burns. Causes of burns, that would be a flame burn, contact burn, scald, like in with hot water, steam, a steam burn, gas burn, electrical burn, and flash burn. System-based approach on burns. Do a scene size up. Make sure that it's safe for you to actually go in. The primary assessment, remove the patient from the source of the burning. Ensure 10 minutes of the, within 10 minutes of the burn, cool the burn with water or saline. Don't remember, it's not supposed to be cold, it's supposed to be tepid when it was room temperature. And remove jewelry and smoldering clothing. Jewelry because burnt skin kind of tends to swell up, and smoldering clothing will because it's still burning. The primary assessment assess the airway, breathing, oxygenation, and circulation. Look for indications of airway burns and difficulty breathing. If toxic inhalation is suspected, administer oxygen by non-rebreather mask. Primary assessment, now you do a secondary assessment now. Once you've gotten the primary assessment cleared, reassess for mechanism of injury and chief complaint. Check for other injuries, continue to remove clothing, determine accurate body surface area, obtain vital signs, and obtain a history. Remember, our histories would be sample, OPQ-RST, and DCAP-BTLS, whatsoever. Secondary assessment, signs and symptoms, in addition to estimating the body surface area and noting location of the burns, determine the depth. Look for signs indicating inhalation injury. Now, question, let me see if I can remove it. Click on the burn depth that is characterized by dry cough, leathery skin, dry tough, not cough, I'm sorry, leathery skin, and the absence of pain to the immediate area.
A.
Yeah, this would be a full thickness burn. Assessment-based approach. emergency medical care, remove the patient from the source of the burn and stop the burning process. Do not enter an unsafe environment. Do not remove adherent materials from the burn. Brush away dry powders before flushing with water, like powders like chemicals, and remove smoldering clothing. Now, at this point, you're washing down or cooling down the burn and turning off the fire. And then you expose it. And remember, you need to remove the shoe and the sock, and cut as far as you can. Emergency medical care: maintain an airway, adequate breathing, and oxygenation. Yeah, positive pressure ventilation for inadequate breathing. So this is BBM use. Administer oxygen by non-rebreather mask for toxic inhalation, and maintain an SpO2 level of 94% or above. Now, when you administer oxygen by non-rebreather mask, what's the flow rate that you're going to put it under? The flow rate for non-rebreather mask.
Isn't it like 3 to 4?
Yep, that's a nasal cannula. The non-rebreather mask, the one with the bag.
Oh, the one they can still kind of breathe out of it.
Normally in the book it'll tell you 15,
oh,
but
it's, yeah, 15 to 10.
Yeah, you can go 12 to 50, 12 to 15 and whatsoever. But you know, if you want to be aggressive, you give them 15. I think you're wasting a little bit of oxygen once you give them 15. But if that bag at the end, the reservoir bag, gets sucked in every time the person breathes, increase the flow rate. And remember, pulse oximeter will tell you what the percentage of oxygenation is in the body. Classify the severity of the burn. Take into account the body surface area, source of the burn, and source of the burn, location of the burn, patient's age, and pre-existing medical conditions. Transport patient with critical burns immediately. Cover the burned area with a dry, sterile dressing to, remember, they just burned their skin off the dermis layer, so they don't have any protection. So you need to put a made-up protection. Moisten dressings can actually lead to hypothermia, depending. Hold on. Moist dressing can lead to hypothermia because, you know, specifically when you have a long transport. Some systems allow them a moist dressing for about less than 10% of body surface area. But of course, you're going to follow your protocol to see what it tells you. So at this point, remember, the skin itself is exposed, so now you have to treat it. You're going to have to put a dressing so you can actually make a cover for it so it doesn't get infected. Emergency medical care: keep the patient warm, treat for other injuries, and transport to the appropriate facility. Okay. Now, the criteria the American College of Surgeons Burn Center uses: inhalation injuries, partial thickness burns or greater than 10% total body surface area, full thickness burns in any age group, burns involving the hands, feet, face, genitalia, perineum. Now, do you know where your perineum is at? The perineum is that area between the male reproductive system and the anus. Okay, or any major joints. Electrical burns to include lightning injuries, chemical burns, and burns in patients with pre-existing medical conditions that can actually complicate the management, prolong recovery, and affect mortality. Any patient with burns and concomitant trauma in which the burn injury poses the greatest risk of morbidity or mortality. If trauma exposes the greatest risk, the patient might actually need to go to the trauma center before he goes to the burn center. Children with the burns in medical facilities that do not have the proper personnel or equipment to treat these burns. And burn injuries to a person will require special social, emotional, or long-term rehabilitative intervention. Assessment-based approach, do emergency medical care, special consideration for dressing burns on the hands and toes, in other words, the fingers and toes. You separate them by putting a 4x4 in between them so they don't stick. Burns to the eyes, remember, do not attempt to actually open up the eyelid, just cover both eyes by applying a sterile dressing. And of course, you flush it, any chemicals from the middle portion to the side. Okay, so this is an example of putting the 4x4s in between the fingers so they don't stick. And notice how they actually left the toes exposed. That's so you can actually see the coloration of the skin. So if the burn itself is causing any type of circumferential issue, you get to see that there's still circulation going on to the toes or the hands. This is the one to the hand itself. The face, cover both eyes. Assessment-based approach, reassessment. You do a reassessment every 5 minutes if the person is critical, every 15 minutes if the patient is stable, and continually evaluate the airway. The longer the chemical is now, when it comes to chemical burns, the longer it's in contact with the skin, the greater the potential for injury. Okay, protect yourself first. Brush away any chemicals before flushing it with water. Some of these chemicals might actually react with water. That's why you want to brush it off with a brush, and then you basically water it down if there, when very little is left. For most chemicals, flush with copious amounts of water. This is a chemical burn to the ear. Notice I actually kind of ate it, most of it, ate it away. And chemical burn to the hand. It looks like a superficial at this point, but they're still very dangerous. Special consideration in treating chemical burns. When dealing with chemical substances, there are some special considerations. You have dry lime, hydrofluoric acid, carbolic acid, and sulfuric acid. This lady here is actually brushing off most of the, the chemical from the patient, and I can't really remember what this is. It doesn't tell you what it is. It just tells you it's from Mississippi. Oh, it's actually calcium hydroxide, I think. So when you're dealing with any chemical that might have gone into the eyes, from the midline, it's the middle of the nose to the where you're going to drain it to. You don't want to do it from one eye to the other one, because whatever chemicals on this eye, you're going to be transporting it out to this other eye. Electrical burns, all tissues between the entrance and the exit wound or of the current can actually be injured. Damage is caused by heat, and the body's electrical impulses can actually be disrupted. Scene safety is crucial in electrical burns because you don't want to get electrocuted. At the same time, never attempt to remove a patient from the electrical source. You turn off the electrical source and then you remove the patient. Remember, with this type of injuries, you have an entrance wound and you have an exit wound. And usually the part that's actually grounded is the exit wound itself. And actually, electricity is going to travel through the path of least resistance, which is fluid in your system, in your body. So in this one, they show you the entrance wound and exit wound. I can't tell you which is which. But I would imagine the one with the burn part is the entrance wound. And he was probably kneeling on some or putting his arm on something that actually caused the exit wound. Okay. Now this is from a case where a guy was trying to steal a copper wire from a building, and it was still live. Okay. The following findings may actually be associated with a burn emergency. Okay, your scene size up. Pay particular attention to your scene, to your safety Look for burning structures or materials, chemicals, electrical sources, confined spaces, because when there's a confined space, there's more of the toxin or the chemical there. Burned clothing, obvious burns of patient's body, uh, evidence of explosion, and other burn, blunt or penetrating trauma. Form a general impression. Listen to see if you can see or see difficulty breathing, and listen for stridor or crowing from the upper airway. You have obvious burns to the body and clothing, burns to the neck and face, singed hairs, nasal hair, eyebrows, and other facial hair, and carbonaceous black sputum. I know it's tarry black sputum. Look for mental status to see if they're responsive or unresponsive. And in the airway, look for stridor, which indicates upper airway burn, or edema to the oral mucosa, in other words, and the tongue itself, the mouth and the tongue. Burns around the neck or the face would actually be circumferential and black inside the mouth itself. Breathing, normal to increase if airway respiratory tract is not involved. Increased or decreased labored or shallow if airway is actually, or respiratory tract burns. Circulation, you have an increase. Increase may actually be decreased if severely hypoxic. So the pulse can actually be increased, but if they're hypoxic, then their system is going to go down, including their pulse. So skin is normal, and unburned areas may actually be cool, clammy, and pale. The status, priority patients if large body surface area of burns, airway or respiratory tract is involved, critical burns are apparent, or burns involved hands, feet, face, genitalia, and other joint locations. Secondary assessment, do a physical exam head to toe. Check the head, neck, and face. Look for burns, singed hair, eyebrows, facial and nasal hair, dark black sputum, swelling of the tongue itself or oral mucosa, hoarseness, coughing may actually be may cough up black sputum, cyanosis, and listen to stridors and burns in the oral mucosa. In the chest, look for burn squeezing and circumferential burns around the thorax, which may actually stop ventilations. Blunt or penetrating trauma if an explosion actually took over or happened. Abdomen, look for burns, blunt or penetrating trauma if explosions or falls are involved. In the extremities, burns to the appearance of a burn or largely determined by the burning mechanism, for example, thermal versus chemical. Circumferential burns may actually reduce distal circulation because they work as a circumferential burn is going to work as a tourniquet. We're going to be looking for swelling, pain, and discoloration if explosion or a fall was involved. Vital signs, what you're going to be looking for, normal may actually increase with severity of the burn, may decrease, after a few hours. If the blood pressure decreases, at the scene, look for evidence of other trauma like internal bleeding or whatsoever. The heart rate should be normal or increased. Respiratory rate should be normal, increased, and labored if respiratory tract burn is involved. The skin itself is normal in unburned areas. If pale, cool, and clammy immediately after burn may indicate shock from trauma. The pupil should be normal, and NSPO2 levels should be maybe less than 94% if inhalation injury or toxic inhalation has occurred. Take a history, signs and symptoms of superficial burn skin that is pink or red and dry, slight swelling and pain. Signs and symptoms of partial thickness burns, skin that is white to cherry red, moist and mottled, blistered or intense pain. Signs and symptoms of full thickness burns, the skin that is dry, hard, tough, and leathery. Could also be white and waxy, dark brown, or charred. There's no pain to the burn area. and usually paint around the site of full thickness burns because it's surrounded by a couple of other things. Signs and symptoms of inhalation injury: facial burns, singed nasal and facial hair and eyebrows, black sputum, respiratory distress with labored breathing, coughing, hoarseness, and cyanosis and stridor. Emergency care protocol for emergency care: remove the patient from the source of the burn and stop the burning process. Provide spine motion restriction if spinal injury is suspected. Establish and maintain an open airway. Insert an nasopharyngeal airway or an oropharyngeal airway if the patient is unresponsive and no gag reflex is found. Suction the secretions if necessary. If breathing is inadequate, provide positive pressure ventilation with supplemental oxygen at a minimum rate of 10 to 12 ventilations per minute. For an adult, and 12 to 20, adult 12 to 20, I'm sorry, 10 to 12 for adults and 12 to 20 for infants or childs. If breathing is inadequate, administer oxygen by non-rebreather mask at 15 liters per minute. If inhalation or toxic gases or upper airway burn is suspected, if burn is isolated to the area of the body and does not involve the face or possible inhalation, injury, or toxic exposure, base your oxygenation administration on the SpO2 reading and signs of hypoxia. Administer oxygen to maintain an SpO2 level at 94% or greater. Estimate body surface area burns using the rule of nines and determine the depth of the burn: superficial, partial thickness, or full thickness. Apply sterile dressings and bandages around or a burn sheet itself. If the burn is less than 10% BSA or body surface area, dress with wet per your protocol, and dress all other burn injuries. Maintain the body temperature itself, and manage other associated injuries as appropriate. If spinal injuries suspected, immobilize the patient to a backboard. Manage specific burns as follows. Dry chemical burns: remove the patient. The affected clothing, brush off any chemicals, then irrigate with large amounts of water. Liquid burns: you have liquid chemical burns. Remove the affected clothing, irrigate with large amounts of water if the chemical is one that does not react to water. And burns to the hands and feet: remove the rings and jewelry and dress between the digits. And chemical burns to the eyes: flush with copious amounts of water or large amounts of water and flush en route. Thermal burns to the eyes: do not attempt to actually open the eyelids. Cover both eyes with dry sterile dressings. And electrical burns: carefully monitor the pulse and respirations. In this type of case, you might be looking for an irregular pulse. Inspect for entrance and exit wounds, and assess the muscle tenderness. Apply the AED if patients are in cardiac arrest. Now, when it comes to electrical burns, caused by electricity, you might actually get some fractures involved in that case. Okay, transport the patient and perform reassessment every 5 minutes, if unstable, and every 15 minutes if the patient is stable. Okay. Do you have any questions? Okay, reminder again.
No, sir.
Huh?
No, sir, I don't have any questions.
Okay, test is on Wednesday. And if you look at your syllabus, the test is going to be from chapter, let me see. We're past the halfway point, so at this point, it's going to be chapter 7 to 26.
Okay.
Okay, so at this point, let me see. I'm probably gonna. I need to find out how long the test is gonna be, but I'll send you over the answer sheet, and then we'll go over the test on Wednesday. On Wednesday, take the test, and on Friday, we'll go over the test. Let me see what I have scheduled for Friday. So it should be July the 14th. We have 2 chapters, which is 31 and 32. Head trauma and spinal injury. And then we'll see if we can go over the test that day. All right?
10-4.
Okay, if you know no other questions, give me a call if you have a question. So.
Okay, sir. Have a good one.
You too. Thank you.